Hi, this is Mark Struthers, and today's discussion of breast cancer will focus on a Black woman's chance to be more likely diagnosed with breast cancer at a younger age and with more aggressive forms of the disease than other ethnicities.
Today, the mortality rate for all women has dropped from 33 deaths per thousand to 19 deaths per thousand from breast cancer. Despite these advancements, there remains a concerning disparity in mortality rates among different racial groups. Breast cancer is a significant health concern, but it disproportionately affects certain demographics more than others. Black women face a significantly higher risk of death from the disease. The mortality rate for Black women is 39% higher compared to other races. This alarming statistic highlights the urgent need to address the underlying factors contributing to this disparity. This disparity is not just a matter of genetics, it is influenced by a complex interplay of socioeconomic factors, access to healthcare, and biological differences.
The survival rate for Black women diagnosed with breast cancer has been improving over the years, thanks to advancements in medical treatments and increased awareness. However, despite these improvements, Black women still face lower survival rates when compared to other women. According to recent data, the 5-year survival rate for Black women with breast cancer is approximately 82%, while it is about 91% for white women.
Several factors contribute to the lower survival rates observed in Black women with breast cancer. The one outstanding bit of information in breast cancer research is Black women are more likely to be diagnosed with triple-negative breast cancer, a particularly aggressive form of the disease that is more challenging to treat and has poorer outcomes.
One of the primary reasons women avoid breast cancer screening is fear. The fear of a potential cancer diagnosis can be overwhelming, leading many to avoid screenings altogether. Additionally, the anxiety associated with the screening process itself, including the discomfort of mammograms and the fear of false positives, can deter women from scheduling their appointments. Cultural and socioeconomic factors also play a significant role in women's participation in breast cancer screening programs.
In some cultures, discussing breast health and cancer can be taboo, leading to a lack of open conversation and awareness. Additionally, socioeconomic barriers such as lack of access to healthcare, financial constraints, and limited availability of screening facilities can prevent women from getting screened. Socioeconomic factors play a significant role in the higher breast cancer mortality rates among Black women. Many Black women face economic hardships that limit their access to quality healthcare. This includes limited access to regular screenings, early detection services, and advanced treatment options. Additionally, socioeconomic status can affect lifestyle choices and stress levels, which are known risk factors for breast cancer. Many Black women live in areas with fewer healthcare facilities and specialists, making it difficult to receive timely and adequate care. Even when healthcare services are available, there can be barriers such as lack of insurance, transportation issues, and mistrust of the medical system. Research has shown that Black women are more likely to be diagnosed with aggressive forms of breast cancer, such as triple-negative breast cancer, which are harder to treat and have poorer outcomes. These biological differences necessitate more personalized and aggressive treatment approaches. Black women often face challenges in accessing healthcare services, including preventive screenings and early detection programs. Furthermore, there may be disparities in the quality of care provided, with Black women receiving less aggressive treatment or experiencing longer wait times for necessary procedures. Genetic predispositions can also contribute to the higher breast cancer mortality rate among Black women. Certain genetic mutations, such as BRCA1 and BRCA2, are more prevalent in some racial group triple-negative breast cancer, often abbreviated as TNBC, which is a particularly aggressive form of breast cancer. Unlike other types of breast cancer, TNBC does not have receptors for estrogen, progesterone, or HER2. This means that common treatments like hormone therapy and drugs that target HER2 are ineffective against it. TNBC tends to grow and spread more quickly than other forms of breast cancer, making early detection and treatment crucial. Understanding the unique characteristics of TNBC is the first step in addressing its challenges and improving outcomes for those affected. There is a high prevalence of TNBC in women of African descent and women who carry a mutated copy of the BRCA1 gene. Women with TNBC have a high frequency of metastasis to the lung, liver, and brain, and survival is poor. It remains controversial whether TNBC in Black women is a molecularly distinct disease or whether Black women have a higher incidence of aggressive biology driven by disparities. There is evidence in support of both.
Research has shown that triple-negative breast cancer disproportionately affects Black women compared to women of other races. Studies indicate that Black women are about twice as likely to be diagnosed with TNBC. This disparity is alarming and highlights the need for targeted awareness and research.
Factors contributing to this higher prevalence may include genetic differences, socioeconomic factors, and access to healthcare. Several studies show that TNBC occurs in sub-Saharan and West African women at a higher frequency and a younger age than in African American women. One of the reasons Black women are more impacted by triple-negative breast cancer is due to genetic and biological factors. Certain genetic mutations, such as BRCA1 and BRCA2, are more prevalent in Black women and are associated with a higher risk of developing TNBC. Additionally, differences in tumor biology, such as higher-grade tumors and more aggressive cancer cell types, contribute to the increased risk. Historical and ongoing experiences of discrimination and mistreatment in the healthcare system have led to a deep-seated mistrust among many Black women. This mistrust can result in delayed diagnoses and reluctance to participate in clinical trials or follow recommended treatment plans. One of the key cultural differences in the Black community is the set of health beliefs and practices that are passed down through generations. Many Black women may rely on traditional remedies and holistic approaches to health, which can sometimes delay seeking medical advice. Additionally, there may be a strong emphasis on faith and spirituality, with some women believing that prayer and religious practices can play a significant role in healing. These beliefs can impact how Black women approach breast cancer screening and treatment.
Education and awareness campaigns play a crucial role in improving breast cancer outcomes. These campaigns can provide information about the importance of early detection, available resources, and the specific risks faced by Black women. Culturally tailored education materials and outreach efforts can help overcome barriers to awareness and encourage proactive health behaviors. Increasing public awareness about breast cancer disparities and promoting education can lead to earlier detection and better outcomes for Black women. Innovative treatment approaches are needed to address the unique challenges faced by Black women with breast cancer. Research into new therapies, personalized medicine, and targeted treatments can improve outcomes and reduce mortality rates. Clinical trials that include diverse populations are crucial in developing treatments that are effective for all racial and ethnic groups. Supporting innovation in breast cancer treatment and ensuring that Black women have access to the latest advancements can lead to better survival rates. Addressing health inequities is essential in reducing the breast cancer mortality rate among Black women. Systemic racism, discrimination, and social determinants of health all contribute to disparities in breast cancer outcomes. Efforts to address these inequities must be comprehensive and multifaceted, involving policy changes, community engagement, and healthcare reform. By tackling the root causes of health disparities, we can create a more just and equitable healthcare system for all women.
Thank you for your time and attention. If this discussion was of interest to you, please look at my other breast cancer presentations and subscribe to this channel, Mark Struthers' YouTube channel for medical imaging.